Oh my gosh. Destroyed. This is your house.
Sasata caiu?
You have 6 children?
Oh my God. Get out. Go.
We just had to leave the building because there was an aftershock, so everyone who was inside had to come back out. You can see the concern is obvious on the streets right now. They don't want these buildings to keep shaking. They're worried about even more aftershocks. That was in the middle of the aftermath of the deadliest natural disaster in the history of the Western Hemisphere. The earthquake that struck Haiti 10 years ago this weekend killed an estimated 250,000 people and injured far more. Billions of dollars poured into help. Despite that, little has changed. In fact, much of Haiti is worse off than it was a decade ago. But there is one very bright spot that could provide a path for the future, as we discovered on our visit this week. Our trip began in the capital, Port-au-Prince, in the wake of Haiti's worst year since the earthquake. Mass protests, gang violence, rampant political corruption. Jobs are scarce, but perhaps most tragically, basic medical care can be almost impossible to find. So this is the General Hospital in Port-au-Prince, or at least it should be the hospital. After the earthquake decimated the old hospital, a new one was planned immediately after. More than $80 million has been spent on it. It sits empty today. In the meantime, the old General Hospital, what should be the main source of care for Haiti's biggest city, reeks of raw sewage. Piles of trash are everywhere. Ednaïs Anvier and her 4-month-old son have been here for 8 days.
Sorry, buddy. Sorry. Right now he's crying because he got to go use the bathroom.
He has to go and he can't go to the bathroom. I'm sorry. I can't imagine the pain that he's in right now. Many patients don't get treated because they're often required to provide the medical supplies. Something as simple as surgical gloves that the hospital can't afford. But take a trip outside the capital, and you find a remarkable place that many doubted could ever exist in this country. This is St. Boniface Hospital in Fond-de-Blanc, up the mountains on Haiti's southern peninsula. It was started in 1983, and in the last 10 years has become a leading beacon for Haitian hope.
People come from hours away to this hospital, and it could be anything. The emergency room, maternity, anything.
Connor Shapiro is the president of Health Equity International, which oversees St. Boniface. He first came here in 2003, and his wife is Haitian. On the day the earthquake struck, he was at work.
Massive shaking. All the patients came running out of the hospital. All the staff, everyone was running into the yard. We didn't know what had happened. My wife, who was pregnant with our now 9-year-old, was in Port-au-Prince at the time, and I didn't know what was going on.
I can only imagine what that was like.
I was very fortunate. My wife and our daughter, they survived, and many people were not as fortunate. It was a horrible situation.
Instead of falling apart, Boniface has only grown. They now get 500 patients a day and went from an annual operating budget of $250,000 when Shapiro took over to $8 million today. People risk their lives to get here because they have no other choice. This is the entrance road to the hospital. It is full of ruts, it is mountainous, passable only by dirt bikes like this and 4x4 vehicles. These bikes effectively act as ambulances for people who need care. The drive up that treacherous road takes the better part of an hour. That's in addition to the 3 or 4 hours it can take just to get to the entrance. This woman is 9 months pregnant and could deliver at any moment.
Okay. We have patients coming all day. It's a constant flow of patients.
For more than 2 million people on the southern peninsula, this is the only place to get an emergency C-section. The only place with a neonatal intensive care unit.
We have 35 babies here. Over 95% of these babies were born here at the hospital and the maternity center.
If this unit weren't here, what would happen to these kids?
It's very difficult to talk about, but if this unit wasn't here, these babies would all die.
And what percent of them who are here survive?
Right now, we've been able to make it so that 85% of the babies here survive.
St. Boniface has become one of the primary teaching hospitals in all of Haiti. It houses the Spinal Cord Trauma Center that treated many of the people injured in the earthquake.
I think what's great is we're not treating most of those spinal cord injured patients who came from the earthquake. And the reason is they're back home living their lives. They've learned how to become productive members of society despite their handicap. We've been able to reach our goal of reintegrating them and allowing them to go back to being full productive members of society.
That could not be more true for Maxoni Persona. Every morning he wheels himself up the hill to work at St. Boniface, helping people just as they helped him. Persona was trapped under rubble for 3 days after the earthquake. When he was pulled out, he was told he would never walk again. Where would you be if it weren't for this place?
I
don't know, maybe I'd be in the street, maybe I'd find some place to live. I don't know where I'd be.
Very likely might not be alive.
Oui, exactement. Oui.
St. Boniface does not turn any patients away. They also receive no money from the Haitian government. They survive in a mix of private donations and outside grants. Dr. Inobert Pierre is in charge of running the hospital on a daily basis. He's been at St. Boniface for 18 years.
I think we inspire people, and that's why also teaching has been more and more part of what we do here, because we want to inspire a new model in the Haitian healthcare system. And with not tons of finances, there are ways to improve healthcare system with some commitment, accountability, and hard work.
We asked Connor Shapiro why Boniface has succeeded when so many others have failed. There's no magic potion here. It's just been this slow, successful build that has been given time.
Yes, absolutely. The community here has been the leader of this project from the beginning. They're the ones now working here at the hospital. Really, it's about investing in the Haitian people, in the physicians, the health practitioners, the nurses, lab techs who are here already, and we need to invest in them to be able to provide that care. There are lots of excuses for why things can go wrong in Haiti, but we just don't accept any of them because we know that this is the right thing to do.
Lots of excuses for why things can go wrong. We just don't accept any of them.
Jeff, the first baby that you showed and the turmoil of that baby, and then you juxtapose it with what the hospital is able to do. It is incredible, absolutely incredible that there's at least one place, one beacon of hope for
And imagine the heartbreak of that mom who shows up with her child who's been screaming, crying, is in such pain, and she says, we can't treat you because you don't have $1 for surgical gloves.
Right.
And all the doctors and nurses and staff that are on board who are Haitian, who are working so hard to ensure that that hospital is still there.
Every single person who works at St. Boniface is Haitian. They made this concerted and vigilant and determined effort to make sure they build from within and they listen to the community. And that's why it works.
Whenever there's a tragedy, people give money right away. And in this case, you see money that is actually working for this hospital.